Dr. Alieta Eck, thank you for meeting with me today. I'm Art Gallagher, and this video will be on MoreMonmouthMusigns on YouTube. And Dr. Eck, you're 2 days away from the Republican senatorial primary. 2 months passed since you got into the world of national and statewide politics. I read a phone call from a friend from California said, run for the late Senator Frank Lautenberg seat, and you said, I think I can be a good senator.
That's right. I read the Constitution, found I just had to be over 30, so
okay,
I'm qualified.
And you are over 30.
I'm over 30.
Okay. What has surprised you, or what didn't you expect in this process over the last couple of months?
I didn't know what to expect. I just figured go one step at a time, just move forward. I found a tremendous amount of grassroots support and people who just told me what you got to do next. And I had to get the petitions and the signatures. I was able to get 2,300 and I only needed 1,000. I got that in 3 days. Mm-hmm. Some of the undercurrents of the hard things that happen with just people do things that are underhanded, and that was interesting. Then,
for instance,
I also found underhanded. Oh, I was considered a fraud and then I was challenged, and then I found out that that's just business as usual politics. I didn't know that.
Okay.
But and then I find my cell phone just gets these new entries of where I got to be when.
Yeah.
And I didn't know that was going to happen.
Uh-huh.
I'm used to controlling my own schedule.
Right.
But it's been a lot of fun, and it's been wonderful meeting people all over the state.
Mm-hmm. Do you think you'll still be campaigning on Wednesday?
Wednesday.
That would mean
because I won or I lost?
No, that would mean that you won the primary and that you're going to into the general.
I'm hopeful. I have a feeling that it actually might happen.
Really?
Mm-hmm.
Because the polls, and I'll be the first to say I don't know how you measure the turnout for an August election.
Exactly.
But the people who went to school for that, were saying that you're losing to Steve Lonigan by 7-1, mostly as a function of name recognition because you've not been involved before.
That's right. Well, there's signs all over the state, I hear. They just got a text, Gloucester County has signs all over. So my name is out there.
Uh-huh.
The question is whether people are looking at the name and then say, well, who is this? And
right.
looking it up. I have a feeling that the intensity is not really that great.
Yeah.
Other than us, nobody is really tuned in August on an election like this, a special election that is.
Yeah.
So it's going to be the people who have the most intensity. Which candidate has the most intensity is going to get the most voters. Okay.
We're here at your free health clinic.
Yeah.
And thank you for opening it up on Sunday for us to have our chat. Tell people a little bit, what you do here and how it got started.
It's an extraordinary place.
Because it's really kind of an important part of your campaign.
Yeah. 2 years ago, this particular facility was opened. It's 5,000 square feet, but we started across the river, across a canal where it was 900 square feet. It had been flooded, and the church let us do this. We started it because the Medicaid system is so broken, and if we got involved with a lot of Medicaid patients, we'd go under. It's a small business. You need to bring in more than you spend in a business, and that was what was going to happen if we went with the Medicaid system. So we said we don't want to abandon the poor, and therefore we wanted to be able to take care of them. If we did it in a place apart from our practice, where we had lots of volunteers, it didn't cost me anything but my time, I would be happy to do that. And it's been an extraordinary experience. We see 300 and 400 people per month, and we're only open 12 hours a week.
Wow.
The cost to provide care is so low when everybody volunteers, and so it's real charity, and we get the job done.
Mm-hmm. And this is a model for your proposal for taking care of the poor nationwide.
Yes, we think that it's hard to find physicians to volunteer here. My husband and I are very committed, and we're willing to make the income of one doctor so that we can both volunteer here. But a lot of doctors are strapped. It's extremely hard to practice medicine nowadays with all the expenses out there. So the fact that we can't find a lot of volunteer doctors we don't hold it against them. However, we ask them, what if you volunteered 4 hours a week and the state simply protected you from malpractice in your private practice, instead of all the billing back and forth and trying to pay you? Would you be willing to do it? And 92% said they would do it in a heartbeat.
4 hours. 4 hours a week. In exchange for what a malpractice premium is, what?
It's not. It's just the money is part of it, but it's also the emotional trauma of the whole malpractice system, where every patient is a potential litigant. And so you're so careful. I mean, you can tell a patient to do something and then they don't come back, and it's still your fault.
Right.
And any bad outcome is blamed on the doctor in this environment. And it's hard. So we end up doing 30% more tests than we should. And that costs a lot of money.
Sure.
Waste the system.
Yeah. But how much would a malpractice premium be? I've heard estimates from $100,000 to $300,000 a year.
Yeah, it's really astounding. And considering an obstetrician gets about $400 for doing a delivery under Medicaid,
Right.
and they pay roughly $100,000 a year. So think of how many deliveries you'd have to do under Medicaid just to pay your malpractice.
Wow.
It's ridiculous.
Yeah.
So a lot of them just can't afford that. Neurosurgeons, the different specialties pay different amounts.
Uh-huh.
An internist might be about maybe $15,000 to $20,000. So it's not really the money that is the huge thing. And they'd say for 4 hours a week, and if they do the numbers, well, that's not worth it. Well, yes, it is worth it. You're solving the problem.
Yeah.
And you're relieving the taxpayers of a huge burden so now you're a hero again.
Mm-hmm. Good. Well, and you have legislation pending in New Jersey to bring it here, and it's your idea to replace Medicaid with this model nationwide.
Eventually, yeah, it's to reduce the need for Medicaid. So I'm not talking about replacing it totally, but then people now, when they're sick and they have no means to pay, there's a place that they go instead of to the government to fill out 20 pages of paperwork. And they just come, and we would see them. So eventually you wouldn't need Medicaid. They wouldn't go to the Medicaid office. Instead, they'd come here, and that would reduce the tremendous load off of the state taxpayers.
Okay. I watched part of your debate with Steve Lonigan on News 12. And Steve said then, which that was a week or so ago, that there was very little difference between the two of you on the issues, but that why he was a better candidate was because of his political and governmental experience and having been a mayor for 12 years, his statewide activism where he claimed that he was able to turn back Governor Corzine's referendum that would have funded stem cell research. He fought successfully Governor Corzine, and many of us did, Governor Corzine's plan to hawk our highways with monetize our parkway and turnpike, and a lot of other good things that really he has done statewide over the course of his political career. But yesterday I was at a press conference where he said that there's a difference between the two of you now on the issue of life and abortion. He said that it had just come to light that you presented yourself as anti-abortion and pro-life, and that at an event last week, I think it was in Long Hill, you said you were, where he said that you said you were pro-abortion.
Nah.
So could you clear that up?
I am 100% pro-life,
Okay.
100%. The question is, what's the government's role in that issue? And the government does need to protect life. However, in the very, very early stages of pregnancy, how does the government do it? Does it station itself inside every hospital OR to be sure that the D&C isn't really a D&E? And I can tell you that
Maybe just say
a D&C is a dilatation and curettage, which they do for abnormal bleeding. A D&E is dilatation and evacuation, which is an abortion.
Okay.
Okay, so if a woman is pregnant in the early stages, you can say that what do they do about it if they want to terminate the pregnancy? And there'll be doctors who would say, well, we'll do a D&C, we'll terminate the pregnancy. This was done before Roe versus Wade, in states where abortion was illegal. And I think just people kind of winked at it, and it was happening.
So you were saying, like, in states where abortion was illegal, like New Jersey,
Yes.
abortion was happening.
It was happening in the early stages, very
in the
early
stages of pregnancy, not in back alleys, but
Right.
in doctors' offices and in hospitals.
Right, now individual hospitals were allowed to ban it, and St. Peter's Hospital has banned abortion. It's a Catholic hospital, and great, I think that's fine. The question is, how can the government ban them at that stage? And I'm just trying to be practical. I'm just telling you, it was happening. But I'm pro-life. I would do everything I could to convince a woman of the value of that life inside of her. And certainly the later abortions, we can step in and make a difference. Now, I know I might be controversial, but I'm just telling you, it was happening before, and I don't see how the government can end it completely. I'm just being practical. But I am pro-life. I mean, there was a time when I was a medical student. This is a later abortion. The baby was put into a plastic bag alive, sent to pathology. I was presented with this live baby and took it up to the neonatal intensive care unit, and I said, there's a baby here. And they said, oh, we don't do anything with that. At which point I said, wow, we're such a callous attitude toward life in this country. This was a long time ago. It was after Roe versus Wade, but it was because it was totally legal. And I thought, there's something really bad here. I actually went to the police to say, look at how they're treating live babies. And they just kind of shrugged. So I would do everything I can.
That baby in the plastic bag was supposed to be an abortion,
yeah.
and
they just threw it out, a live baby. And
So
yeah, a little feisty kid was still, when they took the baby out, it was still alive. And, I mean, to me, that just breaks my heart.
Yeah. Wow.
Yeah, so I mean, the callous attitude toward life is a sad thing. And I believe in the sanctity of human life from conception to natural death.
Okay, but I'm hearing you say, or I think I'm hearing you say that in the early stages, say through what stage?
I don't know, probably the first 10 weeks.
First 10 weeks that...
Before the woman shows, before anybody knows she's pregnant.
Okay, that the procedure should be, the abortion procedure should be legal.
I don't mind keeping it illegal. That's
Oh.
fine. But just what do you do? Fine, make it illegal if you want. However, how are you going to enforce that?
Well, it happened before. So what the confusion is that you're saying it happened before and the government can't stop it.
Essentially.
Essentially, particularly in the early stages.
That's all I'm saying.
Other than, if it's illegal like it was prior to 1973 in New Jersey and many other states
careful, and it
throughout
wouldn't
the
be out in the
country.
open and overt.
Right.
And welcome, come, have your abortion here. At least we
Right.
could stop that.
Okay. So do
In
you
fact,
think...
you know what's happening? The hearts and minds are changing in America, where you're seeing abortion clinics close down, much to the lament of the people who really want abortion. And I love that, because somehow we're getting through to enough people that abortion is a bad thing.
Okay, so is your message, see, because, when I think about this, well, we can't do anything about it, we can't stop it, so make it legal. That's not
I
what
mean,
you're
we
saying.
tried prohibition because alcoholism was so bad, and that didn't work. So what do? Try it again? Prohibition?
Yeah, but
alcohol
we have
hurts
laws
people?
against murder, and they're still murders. Laws don't prevent things from happening. Laws...
Tell us what the ideal is.
well, they tell us what an ideal is, and they create consequences for having done it. So if you murder somebody and you get caught, there's consequences.
Right.
There's from the Ten Commandments, thou shalt not kill. It's been a
Right.
law against it, but it hasn't stopped it.
Right.
So, but you're interested. I'm hearing you say now it's a little bit
I
more nuanced.
Yeah.
That it's not so much a matter of law, that the
You have to change the hearts and the minds of the people. And
To
that's a
actually-
possibility. That could happen. Where people say, no, this is a life. We need to protect it. And that would be wonderful.
Okay, so you're absolutely pro-life.
Absolutely, 100% pro-life.
You sound like you're a little bit nebulous about whether the early term should be legal or not.
If Roe versus Wade got overturned, that would be wonderful, because then states could decide.
Uh-huh.
Whereas Roe versus Wade took over the whole issue and just mandated that it had to be legal in all 3 trimesters in every 50 states. So that was an overreach of the federal government. And I would love to see some states could ban it if you could overturn Roe versus Wade.
Well, that's an interesting, and I've heard you speak in public about the Constitution. This creates a little constitutional quandary I'm going to give you. If Roe v. Wade were overturned, and then there were federal, and you were in the United States Senate,
Yes.
and there was federal legislation to ban abortion nationwide.
Like they'd have to make a constitutional amendment or something like that. I think
Well,
that's the
if
only
it
way we
were-
could do it.
If
How
it
would
was,
we do it?
whether it be or if they could just do, like the Defense of Marriage Act, it wasn't a constitution, they just passed the legislation. Legislation can be passed,
Right.
and then it has to be challenged in the courts to say whether it's
Right. Right.
constitutional or not. But if there was,
Lawmaking is messy.
It certainly is. I'm giving you a messy question to answer. If Roe v. Wade were overturned, and there was, you were a member of the United States Senate, and there was federal legislation to ban abortion nationwide, would you be swayed by your commitment to life or by your belief in the 10th Amendment of states' rights?
Well, if I had the opportunity to sign a law that would ban abortion as a U.S. Senator, I would sign that. I would endorse that. I would endorse it. I would endorse it. Now, I know, I guess the executive is in the, they have the responsibility of executing the law, so
right.
Maybe that's their problem. But
you would,
yes, I would do it.
Okay, it's a hypothetical question.
It's very hypothetical, but yeah, I need pro-life, and I would use every bit of my influence to favor life.
Uh-huh. And do you find yourself in that position here at the center?
No.
With women?
No, actually, because we're so limited in the scope of what we can do, only 12 hours a week, I don't do any gynecology. I'm not a gynecologist, I'm an internist. So we don't even do GYN exams, much less abortions. And I wouldn't, no way would we do abortions here. No, but I could control that.
That I understand, but are you in a situation where you're, or do you find yourself in a situation where you're counseling families
yes.
confronting that choice?
Yes, and I will not refer for an abortion. I can't think of anybody that would be a good abortionist. Mm-hmm. So I would just say I can't help you, but I would try to convince the woman to save that baby. And we do have counselors that will come by within 2 hours, they'll be right here, to help the woman with that decision and say we'll help you every step of the way.
And what is helping?
I had to start crisis pregnancy centers when I was early in my medical career.
So you did
crisis pregnancy centers,
right, okay.
Which is they're the centers where people go when they find out they're pregnant and what do I do, and we counsel them for life.
Uh-huh. And you say every step of the way. Is that every step of the way through birth or through high school graduation?
Well, yeah. Well, we're not going to promise to support them, but financially, but we'll be there as the emotional support, and the community here has supported lots of single moms, and we're happy to do that.
Okay.
We have an adoption. It's a wonderful adoption program, and then we help children that are foster children, and we have children who have been we're foster care. We promote here to take the little kids in that are struggling and need a nice home to stay in.
Okay.
So we do that.
Good. Now, in the event that you win on Tuesday, win the Republican nomination for Senate, which is possible, not predictable, but anything
Nobody
can
knows.
happen in this.
Nobody knows.
In this. Do you have a preference as to who you want the Democratic candidate to be?
I would take any one of them on.
You take any one of them on. Okay. Now, and the polls say that it's going to be Cory Booker. I'm not so sure about that. I've endorsed Frank Pallone because it would be better for the traffic on my website. if we could cover the race to replace him in the 6th district, but Cory's operation campaign seems to be running by national Obama people, and Pallone is working very, very, very hard on the ground. And I've witnessed him. He's been my congressman since 1994 when I moved into the 6th district. I've witnessed him turn out votes like you couldn't believe, particularly in 2010. He got Plainfield to come out, 78% to less than 10% against the Republican. It was amazing. But so I wouldn't be shocked if Frank Pallone wins. But how you've raised about roughly $50,000 for the primary
8 weeks. I thought it was pretty
in
good.
8 weeks. And the other day on the phone, you told me you wish you had another 4 months.
That's right. Obviously I haven't been able to be everywhere, and I haven't been able to go every corner of New Jersey to really get people to know who I am.
Uh-huh.
And I thought that would be plenty of time to get enough name recognition if that's what I needed.
Okay. So, but you'll only have 2 months if you win. And Cory's already raised $8 million.
But if I win, going from
Right.
0 to winning in 8 weeks for
Uh-huh.
$50,000, that would be significant.
Yes.
People would really pay attention. Who is this?
Uh-huh.
And so I think if I had to go against Booker is out there. He's not in his city a lot. He's just with a lot of nationally, he's meeting with a lot of people. I don't know how devoted he was to really fixing the problems in Newark, because they're not a whole lot better. But he got a huge amount of campaign donations, and that makes me suspect. Do you think they're giving money to him because they love America, or they love the common people, or do you think they're giving money to him because they figure they're going to get it back with favors or whatever kind of special connections he's going to make? That's the cronyism and the crony capitalism and the corruption that I see rampant in this country, which I think we really need to change. So
Yeah.
I would go after him on that.
And well, he's raised $8 million already, and
What's he going to do with it? I don't know. How many commercials can he make? How fancy are they? I don't know.
Yeah,
If I can listen
how
to
much do you
this,
think you could raise?
I don't know. I have no idea, and it's just not on my radar screen. I think I get a lot of support from the rest of the Republican, maybe the National Committee, Senatorial Committee. I do know there are some physician groups that would back me, but not that I can't imagine $8 million. I don't know how they would do that. But again, how much do you need? If you can really capture the hearts and minds of the people. I was in Newark at the NAACP debate that Lonigan didn't come to, and I was able to have a forum with them, and it was a good discussion about the problems that they face.
Mm-hmm.
And I learned, and then if I could convince them that the way that Frederick Douglass thought, he was a Republican, he was a black Republican at the time of the Civil War, and he believed in the Constitution, he believed in small government and individual responsibility as a way to just raise the standard of living of all the people. And Newark's in a quandary, because if they're constantly looking for dollars to come from outside, they're never going to get very far. It'll never be enough. Where they need to just get off the streets, and they need to be out there being entrepreneurs, getting better educated. I talked to them about the whole idea of being able to choose what school their children go to so that they wouldn't be stuck in failing schools, and they like that. And I don't think they're terribly fond of Cory Booker in Newark, from what I could tell. In fact, the people who come here to the clinic while Cory Booker is out gallivanting, they can't find any medical care in Newark, and they're coming to our clinic, which is about an hour away, and we help them. So they're ready to go and campaign against Cory Booker for me.
Are they campaigning for you in Newark? You think you'll get
Not
more?
yet. I don't know.
You think you'll get more votes in Republican votes in Newark than Steve Lonigan will?
That I think I will.
Okay.
I don't know how many. I don't know how many. Actually, at this NAACP debate, there were a fair amount of Republicans there.
Was there?
And I was pleasantly surprised. I don't know why I thought that, anything else, but there were businessmen there that are Republicans.
Okay. Good. Now, in the event that you don't win on Tuesday, is your political career over? You just go back to taking care of poor people and building your practice and.
I don't think so. I don't want to let down the people who have come around to support me, because I really think I have a message that is significant. Exactly what I'm going to do, give me time to think that through. But I'll be back. I will be seeking public office from then on. And there's a good chance it will be the U.S. Senate. I don't know who my opponents would be, who would challenge me as far as the Republicans. But I'm sure there's lots that are chomping at the bit to get in. And we'll
I
see.
guess if it's Cory Booker, Senator Cory Booker, maybe not.
Oh, maybe not. Oh, I would definitely try again.
So
Yes.
if you lose a nomination and Booker is the Democratic candidate and Booker beats Lonigan,
Right.
Yes. you would run for U.S. Senate next year.
Yes.
Okay. What if Lonigan beats Booker? Would you run a primary against Lonigan in June?
I can't see that scenario possibly happening.
I know, but I can't see the scenario of you winning either. And,
Oh, I see.
but
Okay.
if you did, I mean.
Go after Lonigan again? Boy, that's too hypothetical. Don't make me answer that now. I don't know.
Okay, right. But and is there any other office? Would you consider running against Rush Holt in the?
Yeah, but I've been approached to do that,
Uh-huh.
to challenge him, because he's in my district.
Yeah.
And that might be a good possibility.
Okay, good. Any just the federal level? Any statewide ambitions as a possibility?
Remember, I went to having absolutely no ambition of being a politician.
Right.
on June 3rd is when this all happened. So it's not like I'm looking around for some other job. I have plenty to do here. I need to work to get the law passed in New Jersey so that we can do the only viable entitlement reform suggestion is ours.
Right.
And and that is the one thing that is so pressing in this country. So we're spending $1.40 for every dollar we take in. It's a huge problem.
Yeah.
So I would I've been doing that, and then just I don't know.
Okay.
Don't hold me to it, but I would imagine I'd try to go after the U.S. Senate again.
Okay. Great. Dr. Eck, thank you very much for taking the time on Sunday, and you probably got other campaigning and phone calls to do.
Yep. Thank
Good
you.
luck on Tuesday. I'll be in touch.
Okay. Thanks.
Okay.